Hi everyone, this video is part 2 of the 5A series for AP Psychology students. This particular lesson will focus on identifying the causes and symptoms of a selection of mental health conditions within the categories of neurodevelopmental, anxiety, and obsessive compulsive related disorders. As you can see in our unit outline, we are in the section titled Selection of Categories of Psychological Disorders. The Diagnostic and Statistical Manual of Mental Disorders has 20 different categories and almost 300 different disorders. You will not need to know all of them, just a selected few of them. And the College Board has picked out 10 different categories. And within each category, they expect students to focus on a few of the different disorders. And in today's video, I will focus on 3 of those categories. Now, this video will focus on the primary theme of symptoms and causes of each category of disorders. So this should be what you focus on as you take notes and listen today. These are the vocabulary concepts that you should take note of while watching today's video. By the end, you should be able to define and describe them. Now let's start with our first category. This is called neurodevelopmental disorders. Some psychological disorders emerge very early in life and affect development. These are called neurodevelopmental disorders, which are conditions that arise as the brain is developing. They begin in childhood and alter how individuals think and behave. General characteristics of neurodevelopmental disorders involve difficulties in communication, behavior, and cognitive processes. The first neurodevelopmental disorder you need to know is called attention deficit hyperactivity disorder, or ADHD. ADHD is characterized by difficulty with attention, impulsivity, and hyperactivity. ADHD can often affect academic and social functioning. Symptoms of ADHD must last 6 months or more to prove that the patterns are consistent and stable and present across multiple settings. According to a 2002 CDC report drawn from a national survey of parents, it's estimated that about 7 million US children between the ages of 3 and 17 years old have been diagnosed with ADHD. It's also more commonly diagnosed in boys than girls. Children who have ADHD and another co occurring condition like behavioral or conduct problems or learning disorders or anxiety or depression are often seen to have more severe ADHD than children who have ADHD without co-occurring conditions. About 1/3 of children diagnosed with ADHD will have symptoms lasting into adulthood. ADHD can be managed with the right treatment, which varies depending on the individual, their family, and their environment. Behavioral approaches include parent training, classroom interventions, peer-focused strategies, and developing organizational and training skills. Stimulants are most widely used to help with the symptoms of ADHD, with 70 to 80% of children experiencing symptom improvement when using those medications. While you can also use non-stimulant medications, and those typically provide longer lasting effects. The second neurodevelopmental disorder that you need to be familiar with is called autism spectrum disorder, or ASD. Autism spectrum disorder is a disorder that involves challenges in communication, difficulty with social interactions, unique patterns of learning, repetitive behaviors, rigidly fixed interests, and sensitivity to sensory input. The abilities of people with ASD vary greatly. While some may have strong verbal skills, others may be nonverbal. And the levels of support also vary, with some individuals with autism spectrum disorder needing significant assistance in their daily life. Others can live independently. And according to the CDC's Autism Developmental Disabilities Monitoring Network, approximately 1 in 36 children have ASD. The disorder is found across all ethnic, racial, and socioeconomic groups, but is nearly 4 times more likely in boys than girls. Autism spectrum disorder symptoms appear typically before the age of 3 and may change over time. Some children show their first signs within their first year. As they grow older, individuals with autism spectrum disorder may struggle with friendships, communication, and understanding social interactions. Many also experience co occurring conditions such as anxiety, depression, and ADHD. The exact cause of autism spectrum disorder remains unclear, but it is believed to result from a combination of factors: genetic, biological, and environmental. Several risk factors have been identified, including having a sibling with autism spectrum disorder, certain genetic conditions like Fragile X syndrome, birth complications, and being born to older parents. Diagnosing ASD can be challenging because there is no medical test. Instead, doctors assess behavior and development. Treatment for autism spectrum disorder focuses on reducing symptoms that interfere with daily life and improving overall functioning. Because ASD presents differently in each person, treatment plans are highly individualized and often involve a team of professionals. Ongoing research continues to improve our understanding, diagnosis, and treatment options for individuals with ASD. Anxiety disorders are our next category, and they are the most common mental health concern in the United States. More than 40 million adults, which is a little over 19% of the US population, experience an anxiety disorder. Anxiety, nervousness, worry, and stress are normal human emotions, and everyone experiences them at some point across different circumstances in their life. Normal anxiety is a natural response to external stressors like a job interview, upcoming performances, being late for an appointment, or an upcoming test. This type of anxiety typically subsides once that triggering situation is resolved. In contrast, an anxiety disorder is characterized by persistent, excessive worry that may not have an obvious external trigger. And it does not go away after the situation ends, and it interferes with daily life and social interactions. Anxiety is linked to the autonomic nervous system. It triggers the fight or flight response. Physiologically, this can cause a racing heart, shortness of breath, tremors, headaches, insomnia, or even an upset stomach. Emotionally, individuals will feel apprehensive, intense, restless, irritable, or overwhelmed by worry. And possible causes of anxiety disorder stem from a combination of learned associations, maladaptive thinking, and biological and genetic factors. For example, a person who experiences a traumatic event like a car accident may develop a learned fear response to driving a car. This would be classical conditioning. This would be a behavioral association. Maladaptive thinking can also lead to exacerbated anxiety and is seen in individuals with generalized anxiety disorder. Additionally, genetic factors can play a role, with studies showing that individuals with a family history of anxiety disorder are more likely to develop anxiety disorders themselves, suggesting that there is a hereditary predisposition. Brain chemistry and structures in the brain, like an overactive amygdala or imbalances in neurotransmitters like serotonin or GABA, are also linked to the development of anxiety disorders. So now, as you can see in that note on the screen, there are a list of 5 different anxiety disorders that students need to be familiar with, and I will outline those in the next slides. So, the first anxiety disorder that you need to be familiar with is called generalized anxiety disorder. Generalized anxiety disorder causes chronic, excessive worry about everyday life. This persistent anxiety can consume hours each day, making it difficult to concentrate or complete tasks. People with generalized anxiety disorder may experience fatigue, headaches, muscle tension, nausea, or even sleep disturbances due to their ongoing worry. And to be diagnosed with generalized anxiety disorder, a person must experience excessive anxiety and worry on most days for at least 6 months. And it needs to be related to multiple aspects of life, like work, health, relationships, future unknowns, financial worries, social fears, but it needs to go across multiple aspects of life for most days for at least 6 months. The next anxiety disorder that you need to be familiar with is called specific phobia. Specific phobia is an anxiety disorder that's characterized by an intense, irrational fear of a specific object or situation. People with specific phobias go to great lengths to avoid that object or situation, and the fear experienced is out of proportion to the actual danger that's posed. While it's normal for people to dislike or even have mild fears about certain things, a specific phobia is much more intense and debilitating. A person with a specific phobia might experience overwhelming anxiety that's not aligned with the actual level of risk that's involved. For example, a person with specific phobia of dogs may never spend time outdoors and may experience panic attacks at the thought of going to a park because of the chance they might encounter someone walking a dog. In contrast, someone who doesn't like dogs might just avoid avoid dogs when they see them, but it doesn't affect their daily life. The CED specifically names two types of phobias: acrophobia, or the fear of heights. This is one of the most common specific phobias, and individuals might go to great lengths to avoid high places, like staying away from tall buildings or bridges, or even simple things like staying away from ladders or balconies. And this can limit activities like traveling or sightseeing or going on outdoor hiking activities. Arachnophobia is another phobia that's mentioned in the CED, and this is characterized by an overwhelming fear and anxiety related to spiders. And this is also a very common phobia, and a panic response can be triggered by either encountering a spider, seeing a spider, seeing a picture of a spider, or even thinking of a spider. Next is panic disorder. And panic disorder is characterized by recurrent, unexpected panic attacks. And panic attacks are sudden episodes of intense fear or discomfort that peak within minutes. A panic attack involves at least four of the following symptoms: a racing heart, sweating, trembling, shortness of breath, choking sensations, chest pain, nausea, dizziness, numbness or tingling, feelings of unreality or detachment, fear of losing control, or fear of dying. And these reoccurring attacks often lead to persistent worry about future episodes or behavioral changes to try to avoid them. Some culturally specific expressions of distress resemble panic attacks but are understood differently within their cultural context. When specific behavior patterns or thought processes are viewed as disordered in one culture and not in another, this is referred to as a culture bound syndrome. Ataque de nervios, which translates to attack of nerves or nervous attack, is commonly reported among people of Caribbean, Latin American, and Iberian descent. While ataque de nervios shares symptoms with panic attacks, it differs in a few ways. It's typically triggered by an external event like a loss of a family member rather than occurring unexpectedly in panic disorder. And it often includes dramatic expressions of distress, such as uncontrollable crying, screaming, fainting, which may not be present in panic disorder. It's culturally recognized as a valid reaction to distress rather than a clinical disorder requiring treatment. In Western cultures, where emotional control and an internalized distress is emphasized, ataque de nervios might be seen as a dysfunctional reaction. However, in cultures that value strong family ties and communal support and outward emotional expression, this is a socially acceptable response. So, just to summarize the key points: panic disorder is a clinical diagnosis, while ataque de nervios is a culturally shaped response to distress that may not be considered a disorder within its cultural context. The next anxiety disorder is called agoraphobia. Agoraphobia is a disorder that's characterized by the fear of being in situations where escape is difficult or help is unavailable if a panic attack or severe anxiety occurs. This fear often leads individuals to avoid certain spaces or places or situations, which can significantly limit their daily activities. The condition creates a cyclical pattern. Individuals worry about being in public, experience anxiety, they fear they won't be able to escape if they experience a panic attack, and then they avoid going out altogether. And over time, this can lead to the fear of leaving home. And this is agoraphobia. The next anxiety disorder is called social anxiety disorder. It's also referred to as a social phobia, and it's characterized by an intense worry or anxiety that is triggered by specific social situations. This anxiety is typically related to the fear of being embarrassed, judged, or criticized in social settings. While it's normal to worry about how others might perceive you, social anxiety disorder becomes clinical and a clinical concern when the anxiety persists for 6 months or more and significantly interferes with daily life. People with this disorder may avoid social interactions, or if they find themselves in those social situations, they might experience extreme stress. The anxiety experienced in these social situations is also out of proportion to the actual threat posed by the situation itself. Taishin Kyofusho is a culture-bound syndrome primarily found in Japan, and it's similar to anxiety disorder. In English, it translates to the fear of people or the fear of interpersonal relations. And this disorder is particularly in Japanese cultures and not found in others. It's similar to social anxiety disorder, but it has some really unique features that are shaped specifically by Japanese cultural beliefs. Taijin Kyofusho involves the fear of offending or embarrassing others through one's physical appearance or behavior, with particular concerns about facial expressions, body odor, and body language. Unlike social anxiety disorder, which primarily focuses on being judged, Taijin Kyofusho also includes the fear of harming others by inappropriately behaving in public. People with Taijin Kyofusho experience intense anxiety in social settings, often avoiding those situations where they fear that they may cause embarrassment to themselves or others. While social anxiety disorder, this is more about the fear of social settings and the fear of being judged or criticized. So far in this video, I've covered two categories of disorders, neurodevelopmental disorders and anxiety disorders. And the last category I will cover in today's video is called the obsessive compulsive and related disorders. These are disorders that fall into this category because they have a presence of intrusive thoughts and repetitive behaviors. These disorders often cause significant distress or impairment in daily functioning. You only need to be familiar with two types of disorders that fall into this category, and they are obsessive compulsive disorder and hoarding disorder. These disorders can be influenced by genetic, environmental, and neurobiological factors. The first disorder in this category that you need to be familiar with is obsessive compulsive disorder, or OCD. A common misconception that people have about OCD is that it's about being neat and organized. But in reality, OCD involves severe distress and repetitive behaviors that interfere with daily life. Obsessive compulsive disorder is characterized by two factors: obsessions and compulsions. Obsessions are intrusive thoughts or urges or visual images that cause significant distress and anxiety. Common obsessions are fears of contamination, harming others, making mistakes, or fearing something terrible might happen. And these obsessions create significant anxiety and discomfort. Compulsions are the repetitive behaviors or mental acts that are performed to reduce the anxiety that's caused by the obsessions. The OCD cycle starts with the obsessive thought, like, I might get sick from germs. This leads to anxiety. It's followed by a compulsion, like washing hands. The temporary relief reinforces the compulsion, but the obsession soon returns, continuing the cycle. For a diagnosis, the obsessions and compulsions must cause significant distress or interfere with daily functioning. They need to last at least 1 hour per day. The exact cause of OCD is unclear, but it's believed to involve genetic, brain, and environmental factors. OCD often begins in childhood, adolescence, or early adulthood, and it affects men and women equally, and it can also run in families. And this is obsessive compulsive disorder. The next disorder in this category that you need to be familiar with is called hoarding disorder. A common misconception about hoarding disorder is that this is a result of people who are lazy or lack organization. But in reality, hoarding disorder is a complex mental health issue that's characterized by persistent difficulty in discarding possessions, regardless of their actual value. And this leads to the accumulation of excessive items. It causes significant impairment in daily functioning and can often create clutter that interferes with normal activities or poses safety hazards, like blocking exits or potential fire hazards. People with hoarding disorder typically experience anxiety or distress when they're faced with the idea of discarding items and have strong emotional attachments to their possessions. And it's not just about acquiring too many things, but it's about the distress that is associated with parting with them. And this disorder can lead to social isolation, poor living conditions, and strained relationships. Hoarding disorder often begins in childhood or in adolescence, but becomes more noticeable in middle adulthood or in their later years. It affects men and women relatively equally and tends to run in families, suggesting a possible genetic predisposition. Individuals with a first degree relative, like a parent or a sibling with hoarding disorder, are more likely to develop it themselves. Those with mental health conditions like anxiety, depression, obsessive compulsive disorder, or attention deficit hyperactivity disorder are also at a higher risk. Trauma, loss, or major life stressors like the death of a loved one or childhood abuse can also trigger hoarding behaviors as coping mechanisms. With childhood neglect or trauma, increasing the likelihood of developing the disorder. Cognitive patterns, like the difficulty in making decisions or over attachment to possessions or fear of making mistakes, are all common within people who have hoarding disorder. And it makes it harder for them to discard those items, and it can lead to the accumulation of their possessions. Treatment often involves cognitive behavioral therapy to help individuals both manage their possessions and their emotional attachments. So this brings us to the end of today's video. Let's do a few short questions for review. Remember, I'll read the question out loud and you'll need to pause the video to determine the answer. Question number 1 says, Maria consistently worries about her finances, health, and the well-being of her family. Even when there is no immediate reason for concern, she experiences muscle tension, restlessness, and difficulty concentrating most days for the past 6 months. Based on this information, which anxiety disorder does Maria most likely have? Question number 2 says, which of the following is a key characteristic of autism spectrum disorder? Question number 3 says, which statement is true about culture-bound syndromes? This concludes today's video on identifying causes and symptoms of neurodevelopmental, anxiety, and obsessive compulsive related disorders. On the left-hand side of the screen, you can check your answers to the review questions, but before closing out, make sure you go through those essential questions and vocabulary terms to make sure that you are taking away the most important parts of today's video.